talking about the challenge of national health account. We talk about sustainability of the national health account. The sustainability is very important. And most of the time, we only talk about it because the donors who found it always want us to know how we are going to sustain the various projects and all that. If not because of that, people will not even talk about it. Then linking health financing and then financial management.
Hello, sir.
Yes.
Yeah, please. Challenges of the household estimating household account. I don't know if it is individual household or if the household here means something. I don't get how it relates to the national health account.
Yes, you know, the money that come to you, let's say your income,
Yes, sir.
that come to you as an individual, how much are you setting aside for health expenditure in case you are sick? How much are you having that? What you are spending, is it enough that at the end of the day you are able to leave some money and say that in case of any emergency, as an individual, you can rely on that to be able to.
So, okay, assuming that they know, assuming that they know that amount, would it be accounted as part of the national health expenditure account?
No. You see, when you look at the national health account that we are talking about, it's from the individual level up to the national level. You, the individual level to your account, your health. Your national health account is very important as an individual. Because even when you are spending, you must also ensure that a time will come that you will be what? Indisposed. Or you fall sick. And you must take care of yourself. So are you also saving some money that in case something happens, you should be able to take care of yourself?
Okay.
So you must also consider your personal health account. So if you are able to establish that as a household expenditure, although the government know the individuals, when it happens, they can afford and all that. And that can also, you'll be able to pay your bills into the hospital's account. And bank debts and all those things will be able to reduce a bit. So the household is, yes, important.
All right. Thank you, sir.
You're welcome. So if you look at the Millennium Development Goal that in fact, we have even passed by, that 2015, to achieve that, the countries need sustainable mechanisms of financing health, as well as strategic and efficient financial mechanism of the allocated resources. But as we speak, these have changed. We are not dealing with what? Sustainable development goals. So what are the measures that the countries have put in place to be able to what? Raise money or have sustainable mechanisms of financing health, as well as strategic and efficient financial management of allocated resources. So you clearly have to look at the Sustainable Development Goal, SDGs, Sustainable Development Goals that we have, which we are expecting that by 2030, we should be able to achieve them. If you look at the health sector, we have a lot of the points there. When you look at the Goal 3, there are a lot of issues under there, maternal mortality, reproductive health, so many issues under it. When you look at the Goal 3, health for all, you look at that critically. So now we are no longer talking about what? Millennial Development Goal. We are talking about Sustainable Development Goals. So by 2030, which we still have about 9 years to go, or what are the strategic plans that government have put in place to ensure that they can finance health as well as strategic and efficient financial management at various sectors? We have seen a lot of financial management that has been introduced in the public sector in Ghana, so that at least it will control the stealing and the waste in the system. But how are they managing that? Is it efficient enough to ensure sustainability, especially when you look at the national health insurance? Because the target is that we want to ensure universal health coverage for everybody, or universal health access. Everybody should have access to health care. So are we putting measures in place, resources that will be sustainable to cover all of those things? There also financial principles often define the goals: equity, efficient, and effectiveness, versus financial management principles, which define the processes, that's consistency, accountability, transparency, variability, integrity, stewardship, accounting standards. So we must look at all these principles that we define. The equity, efficiency, effectiveness. These are the things that we are looking at when it comes to healthcare delivery. There should be what? Equity. We are talking about efficiency and not effectiveness, as against financial management principles that we have defined. That is consistency, accountability, transparency, viability, integrity, stewardship, accounting standards. So even though they have maximum, we want to achieve what? Equity, efficiency, and effectiveness. How do we achieve that in the face of what? Financial management principle that we have outlined. We cannot achieve efficiency and then without accountability. We cannot achieve effectiveness without transparency. So you must ensure that vis-a-vis, all of these are brought on board so that they well thought of and then also resolved. Then appropriate disbursement and control of funds will improve the implementation of health financing mechanism. So when we talk about disbursement and control of funds, what does that mean? Especially disbursement, what does that mean? When you talk about disbursements, what does that mean?
So distribution.
Distribution of what?
The distribution of funds.
Money.
Okay. And then control of the funds will improve implementation of health financing mechanism. So you must also ensure that the way you distribute financial resources, and you must also ensure the control of those funds to be able to continue to finance health. Because if you have some sectors and you have concentrated on certain areas, others will suffer. So the various levels of financial management effectiveness can also result from incentive in the health financing mechanism. What are some of the incentives we talk about? You remember we talk about performance management support. Do you remember last week? The government can promise a health sector, if you're able to deliver this, I'll give you this. So it's based on our performance management or performance appraiser. How your performance is, that's how the money is located to you. So we look
Yes.
at that. I think you remember last week we look at that.
Yes.
We look at their performance management contract or performance reward. So how you perform,
Yes.
that also depends on how monies are allocated to you. So that is also very important to look at. Then you can look at some of the review questions. But distinguish between health financing and financial management. I'm sure you can do that when you ask. Then list the mechanisms of financing health in your country. What are the mechanisms we have in Ghana through which we finance health? You remember I brought a diagram here. You look at that particular diagram. Do you remember the framework? The mechanisms are there. Also describe key challenges of financial management in health. And what is financial expenditures? How is financial expenditures tracked in your country? How do we track financial expenditure in our country, Ghana? And what is the role of national health accounts? And how can we also improve universal coverage in our country? So some of the questions to ponder on. So what we generally want to look at, auditing briefly, then we'll close. We'll close very soon. We don't waste time today. What time do you think we should close?
Any moment from now.
Any moment from now. Okay, I have some slides that I want to cover so that we can close. I am thinking by the time this session ends, we'll close. So the one that we have started, we'll close. We have spent about 15 minutes into it already.
Yes, sir. So let's finish this session.
Yeah, well, the immediate this session ends, we also close.
Okay.
Yeah. So first we talk about auditing, and we are also saying that that's financial auditing that we have talked about. So in general, auditing is an independent examination of financial statements with the supporting records to enable the auditor to express his or her opinion about the truth and the fairness of the financial statement. So all of this that we are talking about, we are still repeating ourselves, but in generally, it's an independent examination of financial statements with the supporting records or the books that we talk about, so that the auditor can also express their opinions whether you follow the truth or the fairness of the financial statement that you have actually. For assurance that you are following the rules and regulations that are in there. So we have mentioned assurance or the rules and regulations, and then to also management support service. And then we want to look at those one quickly. So the assurance is to provide assurance to stakeholders that financial resources that are released to you by the Ministry of Health or Ghana Health Service to provide healthcare delivery services to your people living in Ghana have been used as intended and properly accounted for. So we undertake auditing to ensure our stakeholders, that is government, Ghana Health Service, Ministry of Finance, where the money is coming from, government of Ghana, Parliament of Ghana, that the money and resources that you are giving to us to provide health service or health care to our people or people living in Ghana, the money has been used for that intended purpose. The money has not been diverted for any other action, but rather the money has been used for that particular purpose for which the money has been allocated to us. So first, you want to assure your stakeholders that the money that has been given to you is spending for the purpose for which it was located. Then we are saying the second one is what? The management support service. This is to assist management in risk management, internal control, and government processes to achieve the goals and objectives of Ministry of Health and Ghana Health Service. The support we are talking about here is that after auditing, they will tell you that, okay, because of this and this, we see the loopholes. So you need to cover these loopholes so that people will not begin to steal from your company. So when they have done that, it's a way of what? Supporting management services so that you can continue to provide services. So what we simply saying here is that there's the management support service. We are saying that when internal auditors or external auditors come and they have carried out audit in your organization, they identify the areas where probably the nurses, midwife, or pharmacists are making money from the service, or those monies are not going to the hospital account. So they will help you to put measures in place so that you can control that. So auditing also give you what? Management support. They will advise you what to do so that those things do not reoccur. That's what we mean by management support services. So for example, auditing have been done in some institutions and they have realized that because you are allowing people to pay cash in the office, when they pay, the workers put the money into the pocket, send home and spend. So when you allow workers, the client or patients to pay directly at the bank and just to bring receipt, if they like, they should put the papers into your pocket and send home. In that case, you are protecting your money. But if the accountant is collecting the money into his office, he can use that sum to buy food. He can use to buy anything because the money is in his account, it's in his hands. But when the people pay at the bank account, they pay at the bank, sorry, and just bring the receipt, there is no way the manager or whoever is charged will use those receipts to go and buy anything because it's not physical cash. Somebody was telling me that money is like already food. If you have it, you can use it. But if they bring receipt, how will you use it? So in that way, you can protect the account. So those are the two things we are talking about here. Assurance, we are saying that you are telling your stakeholders that the money that have been given to you have been used for the intended purpose for which the money has been released. The management support service, we are saying that when the auditing have taken place, they will advise you on areas that you are not doing well, so that they give you support so that tomorrow the same thing will not reoccur. And we also have type of audits. There are two main types of audit that we have. That is internal and external audit. We have internal and external audit. So when you look at the first one, internal audit, it is an independent appraiser within Ghana Health Service, sorry, Ministry of Health and Ghana Health Service to provide reasonable assurance to management on the following. One, the laws, policies, standard procedures, etc. established by management are complied by staff. So internal auditors, they undertake this to ensure that the workers follow what? The procedure, the laws that you have established, especially when it gets to procurement and accounting department. The store, most especially, you are looking at the store, the procurement and account. These are the areas that your mind have to be on at all times so that they are following the rules. Two, to ensure that Ministry of Health and Ghana Health Service establish control measures or control mechanisms that are adequate and provide the assurance that resources are safeguarded and used judiciously. So it is a responsibility of the Ministry of Health and Ghana Health Service to put control measures in place to ensure that all the adequate resources that are provided are safeguarded and used judiciously. So, for example, in the store, there's a storekeeper, but who authorized that things to be released from the store? It might be what? The medical soap. So that you also have a record. The store also have a record. So all the time you can compare. Other than that, the store come and tell you, I have taken this. Meanwhile, you have not ordered for that. They are used for personal reasons. So you must also have measures in place to do that. Then reported financial and a program information are accurate and reliable. So the financial statement that have been reported and program information that are reported, they are accurate and they are also reliable. That is what internal auditors do. And also Ministry of Health programs and operational objective has also been what? Met. It is very important to ensure that you met the organizational policy direction, that you don't create any challenge or does not create any problem for the organization or the health facility. Internal auditors are also employees of Ministry of Health and Ghana Health Service, and they report to the management of the organization. So when they come to audit your facility, they also report back to the Mother Ghana or to the Ministry of Health or Ghana Health Service that this is how you are using your money for. And that also help them to ensure that you follow the accounts that we already talked about. Then beyond that, we can also look at the external audits. The external audits of Ghana Health Service and Ministry of Health is also carried out jointly by the Auditor General and a private audit accounting firm appointed by the Auditor General in consultation with the consultation with the health partners and the Ministry of Health. Unlike internal auditors, they are not employees of what? Ministry of Health and Ghana Health Service, and they report directly to what? Parliament. So when you talk about external auditors in Ghana Health Service, they are not employees of what? Ghana Health Service. They are appointed by the Auditor General, either from the Auditor General Department, or Auditor General appoints private auditors or private firms that undertake auditing. And then Auditor General will employ them to go and audit Ghana Health Service and report back to the Auditor General. And Auditor General lay those reports directly to what? Parliament. So Parliament will take decision on them. If Parliament think that those people need to be set charge, or those who have used the money, they have to be set charge them to pay back, then that authority is given to the Auditor General to set charge them to pay the money back. So the external auditors, they are not employees of Ghana Health Service or Ministry of Health. However, it is the Auditor General that employ private firms or from his department to audit Ghana Health Service on behalf of government of Ghana, and they report back to Parliament. So Parliament take reports and see those who are found culpable are reported, and they are asked to refund the money back to the state, or some of them are in prison as a result of their activities. There are people that like that. You are asked to pay back with interest, or if you are not paying back, they jail you. So that's about internal and external. The difference that I want you to note is that internal auditors, they are employees of Ghana Health Service and Ministry of Health. However, external, they are not employees. Internal, they are responsible. After auditing, they are responsible to report to what? Ghana Health Service and Ministry of Health. External, they are supposed to report to Parliament of Ghana. So those are the clear differences that exist between them. Then we also have other types of audits. We have statutory audits. This one is carried out because the law requires them. Statutory audits are done because what? The law requires that at the end of the year, you need to audit your account. That is statutory. It's the law that requests for that. So statutory includes Companies Act, Parastatal or State Organizations Act. These institutions, the law says that every year they need to audit their account. So the Auditor General have to send auditors to various organizations, institutions to audit the account every year as external auditors. So regional hospitals, they send external auditors to go and audit them. District hospitals and all that, they send external auditors to go and audit them and see how, because that is what the law has established. It is by law, that is statutory audit. Then we also have private audits because of auditors' desire and not because of law. So sometimes you as a owner of for you to see whether your employees are stealing you or not. So you can order that private audit. Then we also have management audit. If management have think that there is some level of inefficiency, they undertake what we call inquiry into the efficiency and then effectiveness of management. So that management audit is not about money, but you employ people outside to come and audit or appraise your services and see whether you are efficient or you are effective or not. Then we have public sector audit. That one is about the Ministry of Finance and the Auditor General. Also set people out to go and audit public institutions. Then we have contract audits. They can also contract when you think that there's some dealings in organization, you can also contract people to go and audit those accounts for you. Then we also have forensic audit. When you have suspected robbery, you are suspected corruption, you are suspected fraud, so you need forensic audit. That forensic audit is involved detail of auditing every resource that you have, everything that you bought, the day that you bought it, the receipt, all those things go into what we call forensic audit. So these are other types of audit that you can see, but the purpose is mostly on those two that we have discussed earlier, external and internal audit. The types of auditors that we have government auditors are there. These are things that you just mentioned ago. We have auditors that belong to government. They are employees of government. We have external auditors. They are not employees of government. They are individuals that set a firm. So you see, accounting firm, maybe Allo and Associates or Nick and Associates, they have established accounting firm. So they can be employed as external auditors. KPMG is a good example. That is international organization that audits a lot of government institutions. Then we have forensic auditors, people who, when there's a robbery, when there's a corruption, those people come on board to audit and identify the resources that have been taken. So those people can actually engage in the forensic audit. Then we have internal auditors, which we know that they are employees of government. They ensure that the internal workers or management follow laid down procedures so that they don't deviate from financial management out of the company. So we have this type of auditors that we have. So we also have the transportation and estate department within the Ghana Health Service, which is also under the auditing system. So this transport and estate management that we are talking about, we talk about the vehicles that the Ghana Health Service have in place and how they are managed, the type of vehicles that they have, how they use them, how they allocate, the policies that they have on these vehicles. And then estate, the development of health infrastructure, accommodation for workers, the health facility, construction of X-ray departments, and all the expansion that happened in the hospital. All of them under this particular institution that we have mentioned, transport and estate department. All of these fall under that. So the transport management to provide adequate fleets of all types of vehicles, well maintained, managed, and deployed particularly to the lower levels of healthcare to support priority health interventions. So the transport department, because you're also going to be in charge, all the transport that you're going to have is going to be under you. How you deploy them to the various areas, to the sub-district levels and all that. You must have a procedure of doing all of that. So they provide a fleet, adequate fleet of all types of vehicles that you need. Ambulance is part of it. And they must be well maintained. They must be well maintained. They must be well managed. And they must be deployed particularly to what? Lower levels of healthcare delivery, so that they support your intervention, your healthcare intervention that you want to see. So it is important that all of these are part of the transport service department. And you must know about them so that you go there, you know what exactly is expected of you. So these vehicles shall be run highly by trained and motivated personnel within the organization. So we also have strategic role of transport in health service delivery. First is for primary healthcare services. So the vehicles are there for what? Immunization, health education. You have the van there. They have the speakers are on top of it. They go and talk about this, promote health in the community, and let people know that their health is in danger, especially when we have this COVID-19 outbreak. they go ahead to organize health education to educate our people. So we must give them vehicles so that they will be able to do that. And when they are going for immunization, they also need vehicles to reach what? Especially has to reach areas, to reach peripheries of villages and communities, to be able to carry out the immunization. Health education is the same thing. They cannot walk over a long distance to go and do that. They need vehicles, they need motorbikes, they need bicycles, tricycles to be able to reach there. In cases where they need a canoe to do that, they must also be provided. So it is important. And also disease surveillance. When the disease outbreak, how do the disease control officer get to the field? They use motorbikes, they use vehicles, they use bicycles. All these are part of what? The transport services we are talking about. So primary healthcare, all of these are this. And then rural outreach. You know, there are a lot of outreach. Sometimes people go on outreach to carry out surgeries. You know, people have hernia and the doctors move from Kolebu to go for outreach so that they can provide those services for people once and for all in the rural areas. Those are the services we are referring to as what? Outreach services that are provided. We can also identify other community challenges and then identify it, move from our facility and go to the community to ratify those issues. They also talk about patient transportation. Also have to talk about what? Transfers and pre-hospital care. Sometimes you must refer your clients and they need transport, ambulance to carry them to the next health care facility after you have referred them. So it is also important. And pre-hospital care is also there. When patients in their homes, they call you that they are sick, you must send your ambulance to pick them from home to the hospital. That is pre-hospital care. There was accident, the ambulance must go take care of the people as they are on the accident, on the ambulance driving back to the hospital. They must take care of them, put on oxygen to provide those services before eventually when they get to the hospital, you provide services for them. So that's another. And then monitoring and supervision. Yeah, and the health directors must go on monitoring and supervision. And they also do that. We can't do those things without vehicle. So they also use those one for monitoring and services for administrative work. They also have haulage for medical and logistics. You see these big buses, this truck that convey drugs from the central medical store to the regions that we have, to the districts and all that. That's what we mean. The central medical store is located in Tema. The vehicles move from northern region, come and take this thing, move to drugs to the northern region, to the northern regional medical store, onwardly distribution to the districts and all that. So that's the function they also perform. Across the country, we now have 16 regions. So this haulage also come, take this facility, these materials, and then send them to the various regions for onward distribution to the districts and all that. So they also perform those functions. And we also have the specialist outreach services. I even mentioned some of them when we are looking at the rural outreach. There are people who also provide special services, and they also need vehicles or mediums to reach these people to provide specialist services. So they also need vehicles. Meant from one place to the other for administrative purposes, they also need vehicles. So all of these are strategic role that transport play in healthcare delivery. Primary healthcare is one, patient transportation, monitoring and supervision, haulage of medical logistics, including drugs and all that, specialist outreach services, and general administration and then assignment. Then beyond that, you also look at the functions or responsibility of Transport Department of Ghana Health Service. What are the functions that the Transport Department perform? Formulation of Ghana Health Service Transport Management Policy and general management of transport resources, how they manage the vehicle. 2, prepare Ghana Health Service transport procurement budget. They must also have procurement budget for vehicle that they need, the brand that they need and all that, including the annual procurement plan. This year, how many buses or vehicle we are going to procure. All those things are part of the procurement policy or the annual year preparation. Also advise the vehicle procurement and allocation. Which vehicle are we going to buy? And which department are we going to allocate that vehicle to? They also advise on that. They also develop and maintain national inventory of all the Ghana Health Service fleet of vehicles. So at the national headquarters, now when we go, there's inventory. They can tell you at the Ghana Health Service headquarters how many vehicles belong to Ghana Health Service in Greater Accra region. how many vehicles belong to Ghana Health Service in Central Region. They can tell you, and the area that the vehicles are, the hospital that they are located, district health director that they are located. They can tell you the vehicle that they have because they have a document, they have inventory there. Ensure the compliance of Ghana Health Service transportation policy and other operational documents. Ghana Health Service have a policy on transportation, when there are vehicles to move and when they are supposed to come, when they are not supposed to use the vehicle travel overnight and all those things are there. So that also guide, or those are the functions that you can see in the transport department. And then beyond that, they also talk about how to operate planned preventive maintenance of what? For all Ghana Health Service fleet of vehicles. How are you going to operate the vehicles? What are the preventive mechanisms or maintenance that we have in place? Every 3 months, you have to maintain the vehicles and all that. You also need to talk about all of those things. And also produce transport management performance reports at the specific periods for management. So how do you also produce transport management performance to your bosses? So the drivers also have to fill a form, indicate how vehicles are being managed, and must also provide documents on those one to your bosses. Then also assess and determine the human resource needs of the department. The drivers that you need, do you need to train them? Do you need to recruit a new staff? Or after you have recruited them, you provide them training so that they have much information about what exactly they are supposed to do. You must provide information on all of those things. You must also advise and initiate vehicle inspections. Advise and initiate vehicle specifications, disposal and replacement. What are the specific vehicles that you are going to procure? What are the specifications that you need? How do you dispose those vehicles that are no longer in good condition? Do you sell them auctions or do you dispose them? All of those are the functions that the transport department carry out. And how do you replace them when you realize that district director's vehicle is no longer good? You want to dispose them. How do you replace them? You must also have a plan for that. They also talk about you have to undertake transport monitoring and evaluation, support visit to what regions. So the national level, the ones in charge of transport, they move to the region to see how they are also maintaining their vehicles, to monitor and evaluate whether they are taking good care of the vehicles. The maintenance is very important. Another thing that you can look at also, any other transport related matters that are assigned to them, they also look at all of those things to ensure that they follow the procedure that exists. So those are some of the issues that we can look at when it comes to the transport. However, finally, before we leave, there are also 5 major subsystems or components identified in the system. We just identify them so that the next time we meet, we'll look at them and explain them. We have the policy department or policy management. We have operational management. We also have management information system as part of the transport management system of Ghana Health Service. We also have fleet management. And finally, we also have people management. So these are the 5 key areas that are issues that are major components of what? The Ghana Health Service. They look at the policies concerning transport, what is the operational management, management of information system, fleet management, and people management. So we'll end it here. And when we meet again, we'll look at them one after the other. If you have questions about all that I have said so far, I have not paused for you to ask any question. Please let me answer the question before the session ends so that we can close.
Okay, sir.
Yeah. So if you have questions, please ask them so that I can respond. We just have about 3.5 minutes so that I can respond to them before the session. When the session is over, that is the end of our class for today. So that people who want to go and prepare their animals for tomorrow, they can go ahead and do that.
Oh, sure.
So Wednesday, I'm also expecting some meat. The one who is saying sure.
Oh, you do have problem. You do have problem.
Sir, please ask Rabbi. Sir, ask Rabbi. Ask Rabbi.
Who is Rabbi?
Rabbi. Ajia Rabbi. She will sponsor everybody.
Okay, Hajia, please sponsor everybody on this platform tomorrow make sure you send some meat to all of them. Okay?
That via network or what?
No, but you locate where you are so that she can give you the. She can send. We have a lot of delivery vehicles in town.
Okay.
Yeah, so they can do that.
Yes, she doesn't have money.
You say what?
She doesn't have money.
She doesn't have money.
She doesn't have, no money. She doesn't have money.
Okay, no problem.
So say if you can sponsor her, then we thank you very much.
Oh, but I'm not part of the celebration.
Oh, but it doesn't matter. It's there's always a first time.
Okay, all right.
Mm.
Tomorrow we'll see what we can do.
It seems the class doesn't have a question. Even Saka is even quiet.
And you don't have any question. You are tired. So I'm ending the class. You are all tired. I'm ending the class.
They are too quiet.
Everybody is tired. I'm ending the class.
I do have a question. Yes.
Then you reserve your question because we are almost going. We have just 1 minute plus.
Okay, they don't have any question.
Good evening.
Okay. Good evening.
Yes, sir.
Any question? Good night.
Okay. Enjoy your holiday tomorrow.
Yes, sir.
You too.
Yes. Yeah. Bye bye.
Yeah, bye bye, sir.
Yeah.